www.healthcmi.com. Acupuncture continuing education online today. Acupuncture and herbs increase pregnancy rates. This was published at healthcmi.com on February 15, 2020. Simply click on news and look for the article. Acupuncture improves fallopian tube patency and increases pregnancy rates. A combination of warm needle acupuncture and Chinese herbal medicine improves tubal patency and increases pregnancy rates in women with fallopian tube obstruction. These are the findings of a study conducted at the Obstetrics and Gynecology Department at Tongchuan Chinese Medicine Hospital in China. Two groups were compared. One group received tongguantang monotherapy. The other group received acupuncture and the herbal medicine. So again, one group herbs only, another group acupuncture plus herbs. It was a sample size of 88 women. So combination of acupuncture plus herbs, 93% total effective rate, 70% for the herbal monotherapy group. A total of 39% of participants in the acupuncture group became pregnant within 12 months of treatment, compared with 14% in the herb monotherapy group. The study notes that acupuncture plus herbs is safe and effective for the treatment of blocked fallopian tubes and is worthy of clinical promotion when applied in a controlled clinical environment and only with treatments applied by licensed acupuncturists. And I'll say that because we use the term licensed acupuncturist, for example, in the United States or Canada, what have you. But in many states, because medicine, for example, in the United States, is regulated on a state-by-state basis, many states require rigorous herbal medicine training. Some don't. So, for example, if you're in California, acupuncturists are licensed acupuncturists, and in that scope of practice is also herbal medicine, and they receive quite a bit of training. So they are qualified to use herbal formulas like this, and an herbal formula like tongguantang breaks what we call blood stagnation. So this is not something you would give to a pregnant woman, which is why this study is so controlled, because we're using it to break the stagnation in the fallopian tubes to open them. But then once someone is pregnant, and in this clinical test, it's done with pregnancy tests, then we know to stop using the formula because it would interfere with the pregnancy. So again, medical interference of any kind, whether it's a surgical procedure to open up the fallopian tube or whether or not it's an herbal medicine, we can't just say, well, it's herbs, therefore it's safe. We have to keep in mind they're very powerful, and this type of herbal formula is best left in the hands of professionals who are trained in when and how to use it. So I do want to say that because this herbal formula has herbs like Huang Qi and Gui Zhi, Dang Gui, probably no issue with Bai Zhang Chao, which clears heat and toxins. So again, if there's a kind of a chronic PID or pelvic inflammatory situation involved, a chronic infection of any kind, it's going to get at that. There are also herbs like San Lang, Zhu, Lulu Tang, which are going to break up the stagnation and literally dissolve the clots inside the tube and even work on scar tissue. I will say that in many cases, you're going to need to send someone to a surgeon, but here, this is also very effective and doesn't open up the abdominal cavity in any way, so it is relatively safe in a controlled environment. I do want to mention these caveats. The women have been trying to get pregnant for some time. If I look at the stats here, and you can go to healthcmi.com, click on news, and look for the article entitled Acupuncture and Herbs Increase Pregnancy Rates and see a lot of the details of this article. It looks like the women were unsuccessfully trying to conceive for approximately a mean time of 3.7 years. The range was between, a total range was 1.5 to 8 years, and the mean was about 3.7 overall. Mean age was about 32 years, but the range was approximately 23 years to 38 years in this study. The acupuncture points used were Zhegang, no big surprise there. MCA 18, which is the numerical equivalent of Zhegang, Zhongji, which is CV3, Qihai, CV6, so conception vessel 3 and 6. Large intestine 4, Hegu, Sanyin Jiao, spleen 6, and Taishi, kidney 3. Again, we're not going to use most of these points during pregnancy, but to help someone get pregnant, yes, we can use them. Following standard disinfection, disposable sterile needles were inserted and manipulated by rotation using a balanced reinforcing reducing technique, so the Pingwu Pingxie technique. Once in place, a piece of moxarol was attached to the needle handles and ignited, so warm needle acupuncture. The needles were removed once the moxibustion completed, and the needles cooled. Treatment was administered for 5 consecutive days, followed by a 2-day rest. Treatment was stopped during menstruation, and each menstrual cycle made up one course of care. A pregnancy test was administered at the end of each course to determine whether treatment would cease or continue. Now, outcome measures were very detailed. They had the RI and the PI with color Doppler ultrasound, so the resistance index and the pulsatility index. They did high shear complete blood velocity, fibrinogen levels, of course, measuring pregnancy rates, and they get into all the details and the numbers. And when you combined acupuncture and herbs, they increased significantly. So we see in the objective results quite a bit of data showing that combining acupuncture and herbs improves outcomes. There was a 6-month follow-up. 4 women in the herbs-only group and 13 in the acupuncture group had become pregnant. Again, with 44 women in each group, that's a good percentage. At the 12-month follow-up, another 2 women in the herbs-only group, another 4 women in the acupuncture group became pregnant. The overall pregnancy rates after 1 year were 14% in the herb monotherapy group and 39% in the acupuncture plus herbs group. The total effective rates were calculated for each group as well, and they had several tiers. So you had your effective, slightly effective, and ineffective. So we had 15 complete recovery for herb monotherapy, 16 effective, or slightly effective, and 13 ineffective, 70% total effective rate. The 93% in the acupuncture group was 32% recovered, which meant pregnancy, right? 9 improved means the numbers and the indices are looking better, things like that. And 3 ineffective cases, so they had a 93% total effective rate. So what you're seeing is the distinction between getting pregnant and the total effective rate, because they are at least improving, so down the road they may get pregnant. The results of this study suggest that acupuncture is beneficial for unblocking the fallopian tubes, and there were no adverse reactions, or no serious adverse reactions, I should say, because people might feel a little dull ache or something at a point or something like this. Mostly people just relax and fall asleep with a treatment like this, or just feel very peaceful. To note, we do have a lot of continuing education courses for CEU and PDA credit for licensed acupuncturists at Health CMI covering topics like this. We also have courses specifically geared towards the treatment of pelvic inflammatory disease. Those types of, typically due to infections, can lead to blockages of the fallopian tube. So PID in Chinese Medicine Part 1, for example, is an ebook style continuing education course with a lot of incredible herbal formulas and acupuncture points, highly recommended. And there's also a video course which is quite good. It's the Pelvic Inflammatory Disease Essentials course. It's a video with lots of slides. It shows you the formulas. It's quite complete, and really you can get a handle on that and what are the primary herbs. We mentioned Baizhang Chao, for example, earlier, and many other herbs that are very key in not only moving the blood and dissolving stagnation, but also getting rid of the infections. Because in the case of pelvic inflammatory disease, the acute infection is basically a medical emergency. And in that situation, whether it's caused by an external infection, after having a procedure where the abdomen is open, from a STD, whatever was the cause, there can be high fever, it can be life-threatening. That's, typically just antibiotics, sometimes hospitalization, serious business there. In the long run, though, what are you left with? Just, if you didn't get it, exploratory surgery and antibiotics, not great, right? That's when the herbal medicine and the acupuncture are essential, because we can get this. This is doable. Save the life at the hospital, heal the problem so it doesn't become a chronic problem leading to all kinds of blockages and scar tissue and tumors and growths and chronic use of antibiotics and exploratory surgical procedures. Instead, use some nice herbal formulas, a little bit of acupuncture. Once the acute stage is under control, we can get in there, get the work done, and heal that condition. So that's something we featured in many courses at Healthcare Medicine Institute at healthcmi.com. But again, if we can prevent the adhesions to begin with, that's even better than having to clear them. So this is a very aggressive type of research where you're using very strong we call it dissolved blood stagnation herbs, which we almost never combine in Chinese medicine with someone trying to get pregnant, because it works against pregnancy, except if there's no chance to get pregnant. Then you can open up the tube. So someone has to weigh the options, especially if for any reason the doctors feel like they can't get in there to get the tubes open. And lighter forms of this can be used also if the tubes are just inflamed. And then we can just reduce inflammation. And those can be very safe to use, those types of herbs, in just about any clinical setting without those invigorate blood herbs, but more clear heat and toxin herbs. We can get in there very easily. So there's a lot there. I hope you enjoy this article. Again, go to healthcmi.com. Click on news and look for the article entitled Acupuncture and Herbs Increase Pregnancy Rates. Thank you for listening. I'm Adam White, licensed acupuncturist and herbalist. Everybody's welcome to visit healthcmi.com. The news department is free for everyone. Also enjoy our acupuncture continuing education courses online. www.healthcmi.com.